Today we have Dr. C talking about cosmetic dentistry. We have covered the main questions of cost and financial options. Something that patients often ask is, or a misconception patients have, is that you are going to have to cut down their teeth a lot. And so they wonder, do you have to cut down my teeth a lot, and how long will the work actually take?
Yeah, that's a great question, Randy, and probably one of the top questions, like she said, that I get often is, I want to get veneers, but I don't want you to cut my teeth down. So to answer that question, the clinical situation varies whether or not that we have to remove any tooth structure. So to give you a very simple example, if you have small teeth and your goal is to lengthen them, well, if we're trying to lengthen them and they're small, we don't have to remove any tooth structure because it's all additive, right? We call that no prep or minimally invasive dentistry. If you have a very large tooth that's rotated out of alignment and you want it to look small and in alignment, we have to remove some tooth structure, or we may combine it with some orthodontic therapy. So it really depends on the clinical situation and the aesthetic outcome that we desire. It is more difficult to do minimally invasive dentistry or the no prep veneers, as you know, has gained a lot of popularity in the buzz, because it's more difficult. They're very, very thin. They're like contact lens thin veneers. So they're difficult to manipulate, to handle. The technician that fabricates those has to be highly skilled as well. So there's not many dentists that are well trained in dealing with these thin veneers. So they sometimes go to the more traditional veneers, which are a little thicker, easier to work with. So if you really want just the least invasive dentistry possible, you want to make sure that you're seeking out someone, and a lab technician as well, who is well versed on these materials and techniques.
Great. So for the next part of the question is, how long will it take?
And that's another good question, and probably the $10 million question. At the very least, the first appointment would be what we call a records appointment. It's kind of like a set of engineering plans. We're going to take photos, scans, or models of your teeth and come up with a treatment plan, come up with a small design, a discussion of what our goals will be. We're going to send all this information, the engineering plans, to the lab technician, and that's when the technician and I will sit down behind the scenes to kind of talk about the building of the smile and how we're going to phase it out, what we expect, what challenges we may face. And this is all done behind the scenes. So then the second appointment would be the big appointment. And the big appointment would be, we're going to take the prototype that the technician and I have designed, and we're going to actually put it in your mouth. And so these are called the prototypes, temporaries, provisionals, many different names for it. But what it is are they're training teeth. They're an example of what your new smile is going to look like, but just in plastic, not in porcelain. So you get a chance to eat with it, chew with it, make sure, number one, that it feels good, feels comfortable. Number two, that you like the aesthetics. Because we're changing your smile, you might not know the very first day or the first week. You might need several weeks to make sure that there's not any modifications you want to make. Because you might come back and say, I want them a little longer, a little shorter, a little whiter, a little rounder. So we're going to make those modifications in your prototypes. And when you're 100% happy with it, that's when we send it off to the lab. We're going to take a scan again of your teeth and send it to the lab. Now they're going to fabricate your prototypes in porcelain, which is your final restoration. So the third and final appointment would be what we call the seating of the restorations, where we remove your prototypes and we insert the final porcelain restorations. So the nice part about that is, because you've been wearing your prototypes for several weeks, the day you get your final restorations, there's no surprises because they're made in the likeness of your prototypes. The only difference is the material. So 3 appointments. The first, again, to recap, a records appointment. Number 2, the prep and provisional appointment. And number 3, the final insertion.
Wonderful. Thanks, Dr. C.
Thank you.